Hi, welcome to Missing Capitalism. This is Josh. In this episode, we are joined by Dalton Lackey and Teagan Murphy, co-authors in the article The COVID-19 Murders, Prison Death Worlds, and the Fatal Convenience of Crisis. The work offers a piercing critique of how carceral institutions weaponized the pandemic, not as an unprecedented emergency, but as a tactical opportunity to deepen control, dehumanization, and death. We'll begin by hearing from Dalton and Teagan about their political motivations, the methodologies they employed, and the intellectual scaffolding behind their analysis. From there, we'll unpack their challenge to the dominant narrative of failure, a framing that presumes the prison system was simply overrun by crisis. Instead, they argue that the pandemic revealed not incompetence, but calculated cruelty. We'll also examine how disaster operates as a tool of tactical evolution within prisons. As the authors write, rather than revealing entirely new challenges, our findings demonstrate how the pandemic instead exacerbates what the literature has suggested are the preexisting goals of carceral punishment. We discuss how the incarcerated people themselves narrated these shifts, how they recognized the charade of safety and named the degradation and that exceeded even the brutal norm. From psychic death and coerced docility to the punitive treatment of those living with HIV and AIDS, we'll trace the historical continuities and contemporary parallels that shape this death world. We'll ask how social distancing protocols meant to protect instead expanded estrangement, and how pre-existing conditions of confinement intensified the crisis. Teagan Murphy is a PhD candidate in the Department of Sociology at the University of Maryland. Their research, conducted primarily through qualitative interviews, ethnography, and content analysis, focuses on institutional and carceral logics and the reproduction of inequities via narratives of deservingness. Dalton Lackey is a PhD candidate in sociology at the University of Maryland as well. Their research broadly concerns structural anti-Blackness, carcerality, punishment, and revolutionary social movements, and Fanonian psychopolitics. Dalton is currently working on their dissertation project, which explores the complexities of invention and signification that emerge in the haze of radical collective action against the anti-Black social order. If you like what we do and want to support our ability to have more conversations like this, please consider becoming a patron. You can do so for as little as $1 a month. We bring you these conversations totally independently with no corporate stake or grant funding. Now, here's Dalton and Teagan discussing some of their work. Okay, awesome. So I'm here with Dalton Lackey and Teagan Murphy to discuss their co-authored article, The COVID-19 Murders, Prison Death Worlds, and the Fatal Convenience of Crisis. First, I would like to start off with both of you telling our audience a little bit about yourselves, your political intentions or motivations for this article, and also the kind of methodologies utilized to construct it.
Thank you so much for having us. So I can start out. I'm a sociology doctoral candidate at the University of Maryland. With Teagan, we're cohort mates, and we were drawn to this project first because as an undergrad, I began a project using the American Prison Writing Archives, which is the qualitative data set that we use as the source of data for this project. And there was just exploring the archives for a capstone project. And then in 2021, I believe, Teagan and I, along with our two co-authors, Angelica Loeblack and Caitlin Boltz, we together took a course on qualitative data analysis in group settings. And through that, we were able to reinvigorate the project, especially in the context of the urgency of the pandemic and how it's so brutalized and swept through prison facilities in the United States. So yeah, that was some of the origin thoughts. Teagan, if you want to add to that.
Yeah. When we started working with the American Prison Writing Archive, or using the submissions that are in it, we hadn't planned to write about COVID. I remember we were just kind of starting with a sample of essays. I think we were actually looking at something about racialized time, but we did find a lot of essays that spoke about COVID, and we eventually were able to kind of put together the themes that we were seeing and kind of work that way towards our paper. So I think we didn't start with the questions and the framing that we had for this paper and then look for responses that talked about it. We really just started with the archive and then figured out what themes and what was being discussed in it, what seemed relevant to bring forward. And I think that's also kind of speaks to the strength of the archive, that the people who submit to it can kind of write submit whatever they want rather than it pertaining to particular subjects or asking people to focus on specific things. So what we highlight And the letters that we use are all things that the people who wrote them chose for themselves were important to write about. And that kind of shaped how we ended up with this paper.
Awesome. Yeah, I really enjoyed it. So I'm glad you guys were able to put it together for sure. But yeah, so getting started here, talk a bit about your critique of the framing of failure with regard to the carceral facilities being unable or unwilling to protect incarcerated people from COVID-19, which as of July of last year has infected over 640,000 people and nearly 3,000 have died from it. It has been a year since these numbers were published, so we know the number has only increased. But you state that the narrative that this is a failure assumes that, and I'm quoting here, the prison apparatus is naive or unprepared for simply unprecedented disaster, end quote. I really appreciate that framing, by the way. But yeah, just talk about this a bit.
Yeah. So when we were going through some of the essays that we gathered at the same time, and like just trying to do outside research on basically COVID-19 in prisons, we saw that a lot of articles were using this term failure, were framing the really high COVID-19 rates in prisons and COVID-19 death rates in prisons as a failure. And while we appreciate the goal of these articles in kind of like bringing in this issue to light, and like a lot of these are intended to criticize prisons and the fact that people are dying, we also wanted to challenge this idea of failure. And I think it kind of reminds me of when I go to like police brutality protests or vigils after someone's been murdered by police. There's usually someone who will say that this is actually not a failure of policing, but rather policing operating as it was intended. And I think we can say a similar thing about prisons, that really they aren't failing and they're working exactly as they were intended to. The notion of failure kind of suggests that prison is flawed and can be fixed in a way that takes the safety and well-being of incarcerated and criminalized people into account. But there's really a calculated quality to carceral administrations. And I think that this like failure framing somewhat absolves prisons of this kind of like broader goal, this broader structure. And I think we can talk about this a bit more, and we talk about this a bit more in the paper. I think that previous pandemics also kind of highlight the fact that this isn't an issue of prisons being naive or unprepared, that issues like this have happened before, where there are people in overcrowded prisons who are becoming victims of a pandemic, who are testing positive, who are dying at higher rates than people outside of prisons. And this wasn't new. This has happened before. And I feel like that is the most striking demonstration of the fact that it's inadequate to suggest that prisons just need to be better prepared next time, or that they will ever try to be better prepared for next.
Yeah, and I think our use of unprecedented in this section that you quote is a bit tongue-in-cheek, because that word was so heavily used, especially in the first months of the eruption of COVID, and also used as like some sort of shroud or kind of a cover for carceral institutions to say that they were simply unable to have prepared in advance. And something that we'll discuss as this conversation progresses, like there was a use to COVID, and it permitted a certain evolution of the prison. And that's, of course, not new at all. That what we're arguing here is that prisons recognize the value of crisis. And there's a lot of a growing literature on the uses of crisis. And in a moment, we'll discuss necropolitics, which I think sort of sets the stage for that literature.
Yes, absolutely. So yeah, along that same vein, you say a word about Ashib Binbi, necropolitical death worlds, or arenas where populations are subject to immense cruelty and excluded from the polity. His book Necropolitics is one I found myself recommending quite often, and is one you borrow from quite a bit throughout the article. So can you say a bit about the term itself, but also discuss your interpretation of its meaning and its usefulness when discussing the function of carceral regimes?
Yeah, so we talk a bit about this in our theoretical framework in our article. Of course, Mbembe's necropolitics comes up in quite a lot of, and probably a more diverse array of disciplines than could be compared to like few other concepts, right? Like necropolitics arrives in traditional philosophy and also criminology, obviously, and in general sociology, health literature. It seems to be everywhere nowadays. As we mentioned, it extends from Foucault's really brief discussion of biopolitics, which he only names a few times in his lectures. But necropolitics is, as Mbembe writes in both the article version, which came out in 2003, and his later book on the subject, that it's the subjugation or the subjection of life to the power of death, which we take to mean essentially like the uses, the state or sovereign uses of the threat of death or dying against us, a certain class of people that has been othered, or as he writes, like made the ultimate other. So I think that even though it does show itself in criminological literature, there is still like a lot of absent discussion where it ought to be evaluated. And even Mbembe's, like I have lots of critiques of Mbembe's book because it talks around the subject of necropolitics often. And there's a lot of stuff that is mentioned, like for instance, this subject of necropolitical death worlds, which we apply and extend in our paper, receives a relatively limited amount of like discussion in both his book and certainly in the article that came before. So we are taking like the necropolitical order and the way it operates and applying it to the question of carceral punishment, which it was there prior to it being named, right? Like it's no shock to call the carceral order a necropolitical one, and it's not necessarily a shock to say that the prison is a death world. But we apply it to show that, this is a place where the threat of death is maneuvered in certain interesting and important ways, and that plays itself out in and through carceral punishment. So really this paper, as we discussed a little bit in the theoretical framing and more so in the conclusion, there's a lot of uses, we believe, to be had in merging the necropolitical literature and the literature on punishment.
Definitely. Similarly to that discussion, you state that, and I'm quoting here, while scholars have pointed to the institutional use of crisis, less is known about the role disaster plays in the tactical evolution of prisons, or how these scenes of transition impact incarcerated people. The COVID-19 health emergency thus offers a timely opportunity to observe the prison death world in flux, end quote. So I want to focus on specifically the role disaster plays in the tactical evolution of prisons, right? You illustrate how crises like the pandemic catalyze reformations of the prison that are registrable in the daily lives of those inside. To quote you at length again, where you write, and I'm quoting here again, rather than revealing entirely new challenges, our findings demonstrate how the pandemic instead exacerbates what the literature has suggested are preexisting goals of carceral punishment, control, dehumanization, and death. Importantly, incarcerated witnesses remain cognizant of this relationship and called attention to how degradation during the pandemic exceeded what might otherwise be considered typical in prisons. Even so, prison administrations insisted operational changes were introduced to keep incarcerated people safe, reframing the administrative response to COVID-19 as calculated rather than reactionary. Then is useful as it both takes seriously the violent foundations upon which prison death world is assembled and eliminates how the carceral regime appropriates emergency for its benefit. Any claim to serve the safety of incarcerated population was, in the words of one witness, largely a charade, crafted to convince the public, the politicians, the bureaucrats, even itself of the prison's efforts to reduce risk of the virus, end quote. So yeah, just first of all, excellent quote. I really appreciated that phrasing. Just discuss the role of disaster and emergency in this, what you call the tactical evolution of prisons.
Well, thank you, first of all, for selecting this excerpt, and then also to emphasize that last quote that you mentioned from a witness who we cite. And yeah, I think while we were writing this paper and doing the data analysis, we were so impressed by the way that this story was already told, right? Like we were just putting words to things that incarcerated folks had already found to be true in their everyday experiences. And the fact that this witness in particular goes so far as to say that the incarcerated the carceral administration's response to COVID was a charade, and also that interesting use of that it's trying to convince itself of efforts to reduce the risk of the virus. We all found especially compelling. And I think to your question about the uses of prisons, one thing that we tried to or the uses of emergency by prisons, excuse me. One thing that we wanted to emphasize was that we were discussing and evaluating these moments, as we say, of the prison influx, which I think is an under-examined component of this, as I mentioned, the rising literature of the uses of crisis, like for instance, like Naomi Klein's work on disaster capitalism, or even Agamben's states of exception, which was important for Mbembe's necropolitics. So there are these moments where states or sovereign, or even just a powerful entity for Mbembe, for instance, he doesn't necessarily rely on an analysis of the state alone, but simply like powerful institutions or bodies make use of emergencies and crises to their advantage. And that for us, another necessary part of this story was that incarcerated people wrote about how they were aware of this, right? Like, and there were instances where witnesses wrote that they were afraid that the changes that had been implemented in response to COVID would remain, right? And unfortunately, our own data analysis can't speak to this because we were only evaluating data from during the peak of the pandemic. Now that we're 4 years into the pandemic, there's probably plenty of data to show that, how this has played out, right? How incarcerated people were right to be anxious about the stability of some of these changes, like the lockdowns and the appropriation and implementation of what prisons are assured was COVID-related quarantining, which was in fact just a reason to essentially like proliferate the violence of solitary confinement. And again, to speak to your question, and I think what we tried to arrive at with our paper was that prisons, not to take like the conspiratorial stance that prisons are somehow involved in the implementation and the emergency itself, right, of COVID-19, but that they make use of the moments where suddenly there is less oversight. Suddenly the prison is given an influx of emergency funding. Suddenly the prisons are locking down visitation, so there's no one complaining about the quality of living conditions inside the prison, right? So all of these things may not occur within themselves a calculated bend, but in as a total system, we're arguing that the prison does indeed find value and a shroud in emergencies like the pandemic.
Absolutely. Teagan, did you have anything to add to that?
Yeah, so I don't know if this addresses the question exactly. In the excerpt that you quoted from us, there's a sentence that I remember having, maybe not exactly in this way, but I remember we went through so many drafts of this paper, and I remember early on kind of having the sentiment that rather than revealing new challenges, their findings demonstrate how the pandemic exacerbates preexisting goals of carceral punishment, control, dehumanization, and death. And I feel like that idea of like control, dehumanization, death was something that came out really early for us. And I know that like we've had versions of that sentence since like our first draft. And I remember when we were getting like feedback for the paper, there was a point that we were kind of challenged on, even like our framework of using death worlds. And the idea came up that, or it was suggested that because prisons use incarcerated people as a source of labor, that the idea that prisons would kill inmates is antithetical to that. Like, why would prisons be death worlds that drive the killing of inmates if they use inmates as their workforce? And I think that kind of misses that. I mean, it's not necessarily about actively killing, but just accepting death, that like death is just like acceptable. I mean, death is, yeah, it's mundane, it's acceptable. It is also weaponized. Mm-hmm. And I mean, there's also, of course, the sheer fact that incarcerated people are also considered a disposable and replenishable workforce. Mm-hmm. So there is no reason, even from that perspective, for prisons to worry about the deaths of incarcerated people from like a labor perspective and a loss of labor perspective. And I think that we haven't talked about this much, and I don't know if now is the time to talk about it. We might talk about it later. Just this idea of death and death worlds, and also like concepts of living death and social death really shaped our paper early on. And we ended up talking about things like living death and social death a lot less in this final paper, because we do hope to expand on it in a second paper. But those were concepts that shaped our paper very early on, and our overall framing for this current final paper that we have.
And I'll add too that for Mbembe, one of the most, the primary examples of death worlds or necropolitical death worlds is occupied Palestine, right? So we think that there is an obvious relation between what's been called an open air prison, the world's largest open air prison, and prisons in the United States, both in their relation, like in their racialized composition, and also the way their relation to the state and state power, right? So that, I think, is one of the things undergirding our attempt at expressing this, what we say, tactical evolution of prisons, right? And so from Mbembe, occupied Palestine is such a critical example of a necropolitical death world, precisely because it's essentially a geographic laboratory, right, for testing new technologies and also new methods of brutalizing Palestinian people. And this is essentially what we're suggesting here, is that prisons, under the cover of crisis, test or play with even their violence, the violence that they inflict against incarcerated people, just to see not only what works, well, also to get what Teagan just mentioned, what makes people work, right? But also what they can get away with. And already there's literature on how solitary confinement has played out over the last several decades, how it was very common particularly in the 80s and 90s, and has now changed shape. Right now we have like special housing units, or the SHU, which is essentially a nicer or kinder sort of solitary confinement, and also rules against the amount of time that incarcerated people can be sentenced to or put into solitary confinement without cause. And under the guise of COVID-19 and responses to COVID-19, particularly even the language of protection, right? Carceral institutions were able to lock down and split up incarcerated people in visitation in person, and also the visitation via like phone calls or Zoom, and also to make use of plenty of other things that they claimed were responses to the pandemic. For instance, during 2020 and 2021 was among the largest or most prominent years for incarcerated people's organizing, right? And so prison administrations with significant influx of cash due to COVID-19 emergency response purchased new tools for incarcerated people who are attempting to organize, who engaged in direct action, right? So now, like, we had witnesses, right, of seeing the guards in the prisons that house them with new riot gear and shooting them with new rubber bullets and things that, and all the while as we talk about in the paper and as witnesses recount, they're not being fed well. They're in increasingly decrepit conditions, right? And of course, the claim that in order to protect cleaning staff or healthcare workers, there needs to be less prison staff on premises. And so there's, a difficulty accessing medical care and problems with clean atmospheres and spaces, right? So all of these things play out in the favor of carceral institution, which can, as I said, play with carceral punishment.
Absolutely. I really appreciate that. And I appreciated the framing of the excerpt that I read, because I do think there seems to be a hesitancy I see oftentimes with like the usage of like a term like death worlds, for example, in describing a social relation like that of a carceral site, right? And largely because people see the prison as primarily a function of primarily serving the use of like labor, right, and labor relations, if that makes sense, and not of like warfare, right? Or counterinsurgency or repression, right? As like I would argue, like Dylan Rodriguez or Sami Burton or even Ruth Wilson Gilmore, and others like have described prison's like primary function ultimately. So so I do appreciate like you guys getting back to like this understanding that like, yeah, they can actually kill off, you know what I'm saying, hundreds of thousands of these people, because like that is not their primary usage, right? That is not primarily for the primary function of the prison. And yeah, I just think that's really fascinating. So I appreciate that.
Yeah, and I think to respond to that, like, and I think you're right, Dylan Rodriguez's work in particular stands out in that arena. But also that like the insistence on prison as a place of forced labor falls short, particularly when one relates it historically to the plantation, right? Because
Right.
can't follow that logic to claim that the plantation was solely a place where Black enslaved people were workers, right? Like that's doesn't function well.
Yeah.
And we
Yeah.
are hoping to continue writing about how this has been obscured by particularly the sociology of prisons, because there isn't an attendance to that history.
Definitely. And I do think that's like, it just speaks to like the limitations to like the hegemony that, the 13th Amendment critique has had on like, abolitionist discourses, if that makes sense. It's really a really insane phenomenon, in my opinion. But yeah, shifting gears here a little bit, I know I didn't list this in the questions, but I'm really curious about you guys utilizing the narrations of incarcerated persons themselves, right, within the methodology. How were you able to do that? And how were you able to organize that? And then also mix that into like, the kind of statistical model also that you're using and towards the theorization of, the carceral site in this way.
Yeah, so like I mentioned earlier, we started with, I don't remember exactly what we used to find our very first set of essays.
But we just did it temporally, like the first set that was
Like the
available.
most recent.
Right.
Yeah. Yeah, we just started with like I said before, we didn't like start with really like even just like COVID-19 in mind. And so, but we did still have essays that talked about COVID. And there are so many that do, because obviously it was so prevalent to so many incarcerated people and still is. But we started with, that set of essays. And then when we realized that we wanted to look more into COVID-19, we used different keywords related to like COVID, coronavirus, a pandemic, different things like that. We double checked the essays to make sure that they were referring to like the COVID-19 pandemic. And we gathered 132 individual essays or just like individual submissions. And some of them were from like repeat authors, but then we just divided them amongst our kind of like our team and coded them, and we did a lot of separate coding, and we came back together, and I think we might even have pictures of us using like the whiteboard to try and like take the separate things that we coded and then bring them together under common themes. And then I remember we were like having this debate over whether like dehumanization was like an umbrella or fell under a different umbrella. And we were just really trying to figure out what like broader points were already there and present in these essays. And I thought that I had like before this podcast was that there are a lot of essays that in a sense do their own analysis. Like a lot of the authors are aware of their own conditions and aware of not just explaining like at face value like what they're going through, but with like extreme skepticism of the prison and its ability to actually navigate COVID-19 and whether the protections that are like the COVID-19 protections put in place would ever actually do anything for them, the necessity of a lot of the protections. And like a lot of it is right there in some of those essays of incarcerated people just bringing forward not only their own experiences, but critiques of the conditions that they're living in. Of course, we also had a handful of essays from people who maybe expressed like gratefulness for like employees in the prison who were like doing their best or different things like that, or expressed kind of like how there's some sentiments in which people express that like they understand that they're in prison because of what they did, like that it's their fault that they're there. And those are moments where we kind of like are bringing in our own like analysis and interpretations of why people feel the need to say, honestly, I don't know this. This touched on more in a previous draft, and I don't think as much in our final draft, why incarcerated people might feel the need to say like, oh, I deserve to be here. But even some of those would say like, I understand why I'm in prison, but I was never sentenced to solitary confinement. I was never sentenced to this absolute extreme dehumanization that is happening right now because of the pandemic and the fact that like people were unable to leave their cell or go outside or access recreational activities or use the phone and like do all of these things that are usually supposed to be a part of their daily routine that had suddenly been stripped away from them.
Yeah, and in our paper, to that point, Teagan, we referred to that grappling with like a confession and also the seriousness of one's like conditions during the pandemic as like linguistic negotiations, which is to say like incarcerated witnesses retell how they deserve a certain or punishment to a certain extent, but not in the excess form that it has taken since COVID-19 erupted, right? So there's like a fucked up sort of like forced confession that occurs, right? Where it's like, in order to receive essentially like, because it's being published to the APO, which is a public archives, in order to be received well by the public, to be like, for us as readers to empathize with an incarcerated person's experience in prison, they need to admit to to their faults, right? To say like, I am here for the criminal reasons that the legal system said that I was here for, but I should not have to suffer this kind of this new and uniquely brutal situation, right? So there, I think, is two important parts. First is the obvious one that incarcerated people feel the need to admit to wrongdoing in order to receive empathy, but also that this heightened, or as we say, evolved punishment that incarcerated people experience is so unique that it deserves quelling, right? That it deserves like public outrage, which, as we're trying to show in this paper, is not necessarily true if taken in a broader context. That this is not the first emergency that the prison system will abuse, and also not the last, right? So like, if now in the wake of COVID-19, incarcerated people are more isolated. They have less access to visitation, and they have less food, or their nutrition is poor. The conditions are worse because prisons were allowed to become dirtier without cleaning staff there constantly. That this violence only piles up, right? So then the next crisis that the prison system makes use of will apparently, or according to this logic, demand the same claim, right? But just newly stated, like, oh, shit is really bad already, but it's especially bad during this new emergency. And so that cycle continues in a way that, like, as I said, it piles up, which is to the benefit of a system that is interested in brutalizing its inhabitants.
Yes, definitely. I appreciate that from both of you. You kind of discussed that phenomenon, right, of like repentance, right, or like admitting what one's done and like accepting that one is deserving of punishment, but it's just not to that degree, if not, right. And you discussed that phenomenon as psychic death, right? How, and I'm quoting here, the carceral state system aims to force pliant subjects who in turn become exploited representative of its purported rehabilitative competence, end quote. So just like, if you can, talk a bit about this expression of psychic death and what it means and what it requires.
Yeah, so psychic death is, as we mentioned in the paper, a concept offered by Brittany Friedman, who's a Black feminist criminologist and is doing some really fascinating work. And this specifically is from a recent paper of hers in which she sort of extends the literature on social death, and then also makes mention of Mbembe's necropolitics, and then offers her own concept addendum in psychic death. And so as we talk about in the paper, psychic death for Friedman is, and as you quote it, this internalization of docility, which is certainly, I think that it was a great catch on your behalf, is exactly what we find when incarcerated folks confess or admit to a certain level of deservingness in relation to punishment. And as Friedman says, we agree, this is like a coerced effect. And actually, Friedman uses the work of Tony Hatch, on the uses of psychotropic medications, which is like the excess use of drugs, in a way that is portrayed as if it were medically beneficial, right? Or in the best medical interest of the incarcerated person, right? So here are medications, you have access to them now as an incarcerated person, take them, and then your psychosis will be alleviated. But this occurs to an excess degree, as Dr. Hatch argues, which is a component, like a physical component of this attempt at producing the psychic death effect of like, I am a docile prisoner, accepting of my conditions, and willing to bend towards the carceral order.
Definitely. Yeah, I appreciate that. And then there's this section titled Punishment as Protection, which was really interesting to me. You discuss how incarcerated persons positive of HIV and AIDS were treated in punitive ways. Can you discuss some of the treatment, right? And maybe say a word about the contemporary parallels to those infected by COVID-19?
Yeah, so while we were analyzing like the essays that we had gathered from the American Prison Writing Archive, I was also reading the book Criminal Intimacy by Regina Kunzel. And that book focuses on kind of the history of sexuality and sexual identity in the United States, kind of in its like mainstream perception, and how that shaped prisons, prison life, and prison culture. And then also in turn, how prisons, prison life, and prison culture shaped mainstream understandings of sexuality and sexual identity. And in that book, there is a section on the HIV/AIDS crisis and how it impacted prisons. And I just remember reading that reading that book at the same time as we were reading these essays, like just the parallels were immediate. That section of the book focuses a lot on how like the disproportionately Black and disproportionately queer incarcerated folks who tested positive for HIV and AIDS were excluded from educational, vocational, and recreational activities. They were denied visitors. They were denied freedom of mobility. They were segregated. And of course, they were heavily stigmatized. And we were seeing all of these exact same measures being discussed in the essays that we had gathered from the archive. And what also stood out is that these are all things that are usually reserved as punishments. Things like solitary confinement, that is usually a punishment for like an incarcerated, like if someone's not like sentenced to solitary confinement, they can still be thrown into solitary confinement due to their like behavior. And being excluded from recreational activities, being denied visitors, all of these things are typically punishments. And now they're being used, well, now and during the AIDS crisis, they were being used as protective measures because that's all the prison is built for, is punishment. So these were the essentially like the options available for, or at least the options that were being used and then being described as protection. And something that really stood out to me was in Kunzel's book, there was an excerpt from an incarcerated person in Georgia that said, "I was segregated in a cell with beware signs. They gave me reason to believe I was going to die shortly, and it broke me down mentally and emotionally." And I remember reading one of the essays from the archive about the COVID-19 pandemic, someone saying that at their prison, people who had tested positive for COVID-19 were isolated in what was originally used as housing for people on death row, and that it became this very like visceral, like kind of symbol or embodiment of being marked for death. And that, like, all of these really helped bring together like the connections with like death worlds as well. Just the fact that people were constantly facing this fear of death. HIV/AIDS was considered a death sentence for a long time. And there was a point where COVID-19 was also, especially if you were incarcerated, could have effectively been considered a death sentence. And a lot of our witnesses, who I've also referred to as authors, talk about just this constant contention with death and just constantly needing to think about and fear dying. And that one example that I mentioned of the person who was incarcerated during the AIDS crisis, and then the example that we saw of someone incarcerated now, witnessing people just be labeled as basically like about to die.
And Teagan made this point while we were discussing and first writing or drafting the paper, that like it was unavoidable that we discuss the HIV/AIDS crisis because of how immediately clear the parallels between these two events or protracted events played out and continue to play out. And also like that there is this, the doubled expression of necropolitics in both the case of HIV/AIDS and COVID-19, right? So like HIV/AIDS was for the Reagan government and for the reactionary US state, like regardless of who was in charge of it, a benefit to the dying out of queer people, trans people, right? And so too was this, as we learned early in the pandemic, that COVID-19 was afflicting Black, Brown, Indigenous communities more so than elsewhere, particularly poor Black, Brown, Indigenous communities. And then suddenly, you know, there's a suspicions about masks and et cetera. So it's again, this another demonstration of the benefit that crises like these have on behalf of like the rolling social body, right? So it's like the people who are meant to die will die out.
And it brings us back to what we discussed at the beginning about kind of challenging the notion of this being a failure. This would there were other pandemics that we initially did talk more about, like tuberculosis and H1N1, and how those similarly spread in prisons at higher rates, and people were dying, and the only quote unquote protective measures were just punishments. And it is really just striking how similarly COVID-19 was handled, and looking at how the HIV/AIDS crisis was handled. And it's just so clear that there was nothing there to learn from. There's no attempt to try and supposedly do better or prepare for the next pandemic.
Which I think only then benefits our findings and our claims that it wasn't as though this was unheard of. There have been many for the last several decades, but also, the U.S. prison system has been in place since the U.S. began, even prior. So, yeah, there was plenty of opportunity to, if the prison was in the interest or did operate in the interest of the people that it incarcerates, there would have been some sort of preparation. Then I think our witness testimony says that it takes an insidious form rather than being a preparation in their benefit, a preparation in the benefit of prisons themselves.
Mm-hmm.
Yeah, absolutely. And speaking of those, the preparation, right? I would love for you to touch on how the pre-existing conditions of the prison exacerbated the crisis as well. You write that, and I'm quoting here again, penitentiary limitations on nutrition and hygiene threatened personal health and may have increased how susceptible incarcerated people were to the virus, but many administrations claim implementing such changes would mitigate my viral spread, end quote. So just, talk about this a bit.
Yeah, I mean, the most immediate example is overcrowding. That is something that was, with mass incarceration, was already an issue leading up to the pandemic. And then once the pandemic hit, it was made all the more obvious by the fact that a lot of our authors talked about how any kind of social distancing or isolating wouldn't actually be possible. I don't remember the exact quote, someone wrote about how if someone sneezes, it just passes through the airways and it would just spread to everyone. And so that was an immediate issue. That is the overcrowding. And there are also people who talk about how there is no proper ventilation. And there was someone who talks about how there is black mold in the fence, and there's trash, and that just the cells are just generally unclean, and that there are just a lot of unhygienic practices, and just a blatant lack of care and concern for incarcerated people that predates the pandemic. All of these issues were there: the overcrowding, the poor hygiene, and also I think the fact that we write that incarcerated people during the pandemic were at the mercy of guards and staff in the prison, and that of course is true before the pandemic. They're incarcerated people's entire lives, whether or not they are violently assaulted that day, whether they get to go outside, whether they get to have peace in their a sort of peace in their day, is basically determined by the guards and the staff around them. And that is that's already true, but that is further exacerbated by the pandemic and the fact that guards and other staff could simply choose to not let people outside that day and then justify it as a COVID-19 precaution. They could choose to not let people take showers and then justify that as a COVID-19 precaution, or not have phone calls, go to their recreational activities. And a lot of people were also deprived of information as to what was going on. There are essays that talk about being put on constant lockdowns without being told why. I remember someone writing about how people were given COVID tests and then not given the results. People would randomly be put in like solitary confinement or solitary confinement like statuses, if that, or like conditions, if that was feasible. And a lot of times, like all of these changes lacked communication as to why they were being put in place, when they would change. It created just a sense of chaos for a lot of people incarcerated and living through this. But it just really exacerbated the fact that incarcerated people are living at the whims of prison staff.
There was also some interesting discussion from a couple of witnesses in particular, and we make brief mention of this in our paper, that prison staff, wardens, and administrators were appropriating or misusing emergency funds. So for instance, in two cases, for instance, witnesses reports that the emergency funds meant to be spent on food for incarcerated people were being siphoned through the prison system and instead used or misused by the prison warden toward his private business ventures. And so in the place of that, prison, I would assume, or judging by this witness's writings, essentially like committed fraud by writing that the money was going towards, or in their records recording that the money would go towards the proper nutritional food, and instead giving or purchasing and then giving the people incarcerated in this facility what's called Johnnies, right? Or like sandwiches that are just cheese and bread, or hot dogs. And so that was a method that the prison system used, or specifically specific agents in the carceral system used toward their benefit. And again, this is not to say that carceral facilities or even like food, for instance, was good or even was better, but that this event permitted the worsening of it, and was just generally a benefit to the carceral order.
The quote that I was trying to recall before is really a really key one. So I want to make sure I do it justice. It was by Kenneth Key. The whole idea of social distancing would be totally impossible. I live with another inmate 24/7 and open cells on all sides and no proper ventilation. A man coughs and it travels throughout the cell house, and the particles of COVID-19 move like the death angel in the Exodus story.
Yeah. Oh, yeah. If you can, talk a little bit about some of the social distancing protocols put in place, meant to slow the spread of COVID, but it ended up drastically expanding estrangement, as you guys write.
So as witnesses reported, the responses from carceral administrations were often indistinguishable from punitive responses, like that had already been in place prior to the pandemic, right? So like if there was a behavioral problem, and again, this is all dependent on the guards and the administrators themselves, like it's entirely up to them what qualifies as a behavioral issue, then a person could be sent to solitary confinement. And what we found was that in a lot of instances, witnesses shared that the quarantine methods used by prisons for, as they claimed, the protection against COVID-19 were essentially the same methods that they would use for solitary confinement. So that's to say, like splitting up cells rather than having 4 or 3 or 2 persons to a cell, having 1 per cell. And often even the CDC early in the pandemic recommended 14-day quarantines. So in many of these cases, incarcerated folks stated that they were placed in what was previously the physical location of solitary confinement, like the SHU, or as Teagan mentioned too, the places that would have previously held folks who had been sentenced to death or to more severe punishment.
I think that as well. We've talked a lot about like the solitary confinement and kind of just the fact that I think there's an element of incarcerated people being separated from the kind of lives and routines that they would have established within the prison, and like just the interruption to that. But I think on top of that, incarcerated people are obviously already separated from society outside of prison, as like the prison intends. But there are, you know, means of limited means of access through like phone calls and visits, or even through like those recreational activities or TV time and different things like that that were taken away during the pandemic. So along with maybe like within prison life that has suddenly been interrupted, incarcerated people were even further isolated from the already limited access they had to the sort of outside world. And a lot of these witnesses write about a lot of these just feeling particularly unjustified, things like not having access to phone calls in the way that they used to be able to. And like how like a phone call wouldn't be able to bring COVID-19 into the prison, but they weren't allowed to do that anyway. And again, not getting information on necessarily why they were not getting their payphone privileges anymore and when they might expect to get that again. I remember someone talking about how visitations had been canceled and there was no clear news or any kind of articulation about when visitation would start back up again, or sometimes they were told that to be able to plan for a visit and then that would get canceled. And there just being just a general lack of communication and an inability to speak with loved ones, which again, that keeps incarcerated people even further isolated from their loved ones, from their communities outside of prisons.
And we found it interesting that, and this seems somewhat, we could expect it somewhat, but that every time there was a change in policy, it was attached to an excuse that the witnesses reported. So, for instance, like, or one that could be seen as logical, right? Like, so for instance, the termination of in-person visitation, right? So we could say that this is a logical response to the threat of COVID-19, and that like prison transients, the influx are incoming visitors, outgoing visitors, et cetera, and it increases the risk of COVID-19 finding its way to the prisons or finding its way out of the prisons. Or another example would be like limited recreational time, right? So that in theory limits the interaction of incarcerated people with one another. And even those, there are limits to the attached excuse. But then there are others, for instance, like the conclusion of, or the guards didn't permit recreation inside the cells, even when persons were quarantined, right? So they would just say no exercise. Another one, a significant one that was common among witness writings was that of showering, right? So it was like we can't permit people to leave their cells and to take showers. And so often witnesses shared that they had been held without showers for 3-4 days. And so there were like I mentioned, all of these things can be associated with some reasoning that the prison administration insists upon as to why they are electing to, choose this method of response. But those are limited, and they also like fall short in the realization of them, right? Like more the actual reality of those approaches are as punishment, right? For the incarcerated witness, they say we experience this as a violation, and not as something that we believe will protect us from the threat of COVID-19.
Yeah, definitely. Absolutely. So maybe say a word about the social death thesis versus that of the living death, right? Or even civil death. And in your estimation, how do these concepts diverge or converge?
Yeah, so we had initially spent a lot more time talking about the idea of social death in our paper, and we had kind of framed our paper around another paper by Brittany Friedman, which talks about this notion of like disaster and like COVID-19 and its impact on prisons, and kind of like reframing this idea of prisons having any intention of like protecting the people who are inside of the prisons, and how like COVID-19 is really just exacerbating forms of death that are already present in the prison, namely social death, psychic death, and physical death. And we had initially kind of used that as our framing. We talked about physical death, and we talked about psychic death, and we talked about social death. But as we wrote the paper, we became kind of more critical of the way social death was used in Friedman's paper, and also kind of how we were able to apply it in our paper as well. We wanted to talk about all of the essays that we read, and while addressing social death, but we also were kind of grappling with the point that we did not believe that all incarcerated people were subject to social death, and that social death is specifically like something that speaks to the position of Black people in broader society. And I think that Brittany Friedman makes a similar point, but I don't think it's clear in her paper why you couldn't say that all incarcerated people are subject to social death, and why it's specifically a condition related to Blackness and not to like carcerality. And so then we started to articulate there being a difference between living death and social death. And we felt that incarcerated people, as being present like in a death world, any incarcerated person can be subject to living death. And then social death is not necessarily something only limited to prisons either, but as I said, is referring to kind of like the social condition of Blackness.
Yeah, to reiterate too, and to like take even a little bit of a step back, because these concepts are so so heavy. Yeah, so social death in particular does find its way into the criminological literature fairly often, especially now. And I think, and something that we briefly mentioned and is discussed in greater detail in one of the papers that we cite by Chavez, this literature is guided first and foremost by Lisa Gunther's Solitary Confinement and Social Death, a book that was written in 2013. And so there, Gunther essentially, although it makes use of existing discussions of social death, essentially offers a new conceptualization, which is dependent on the experience of absolute isolation, right? And so prior to Gunther, obviously social death was conceived of, at least in the literature that we are interested in, by Orlando Patterson, who was a sociologist who in 1980s wrote a book called Slavery and Social Death, which specified that social death was the experience of the enslaved person. And for Patterson, I guess it's important to note that this is a trans-historical experience, right? Like there is no specifically unique, actually the very arbitrariness of enslavement is something that Patterson emphasizes, right? That it's always been present across human history and is only now debated by the juridical end of enslavement or the legislative end of enslavement. And so we sort of were confronted by this question of social death while doing the initial review of the literature in criminology and specifically on punishment. And we found that social death did something similar to, but somehow distinct from Mbembe's necropolitical, the condition of what Mbembe calls living death, which he expects will be found in the necropolitical death world, right? So like and again, he doesn't really do much to explain precisely what qualities accompany this living death, other than to say it's what the person who is subject to a death row will experience. And so like that tension that we felt existed between Mbembe's concept and Patterson's concept, it feels like, and continues to feel like, it demands some scrutiny. And also you mentioned civil death, which is another concept that's common in criminology, which discusses the experience of persons written out of civil society by law. So that's obviously very relevant to the question of incarceration in the US, where the 13th Amendment obviously stipulates that persons can be enslaved by the state as punishment of a crime, right? But the concept of civil death also then includes, in its very conceptualization, a way out, right? So if a person is civilly dead, which is to say they've been written out of the legal legibility of a given social body, they can be written into it again, right? So that would be that manner of alleviating civil death. And so the same is possibly true of Mbembe's living death. If a person escapes, or if from a death world, or if the death world ends, then so too does their experience of living death. And then for Patterson himself, Orlando Patterson would say that there is a possible end to social death, and social death being, like, as I mentioned, the condition of enslavement. Then to escape social death would be to conclude enslavement and to reintegrate a person into the social body that they were once enslaved by and in. But that is a problem, I think, like that particular way out for social death is a problem if enslavement, as Sadie Harmon says, isn't dead, but it exists, and if emancipation was a non-event, right, which so many Black radical thinkers are attempting to build from and investigate, then social death isn't dead, right? It has changed form with the changed form of enslavement itself. And that isn't something that the literature that the criminological literature on social death tends to confront. Instead, it goes missing, probably as an effect of the general disavowal of the question of enslavement to begin with, which to us, sorry for the long-winded explanation, but then we arrive at this particular problem of the prison, which is both this obvious extension of and new iteration of enslavement, or the slave trade, as like Anthony Farley would say, it's an iteration of slavery perfecting itself, taking an institutional form. And simultaneously, the prison is this institutional expression of Western liberalism's like multiracial protective capacity, right? So it's like the prison is also this place where the raceless masses who threaten the Western public, the good people, are sent away, right? It's like, so then it has this raceless character as well. And so we're trying to confront and are left with this problem of that paradox, where the prison is both a place specifically for the institutionalized expression of anti-Blackness, and this vanguard of multiracial liberal futures. And I think what we're hoping to write on more in the future, and we've been writing on, is we believe that Mbembe's under-evaluated concept of living death offers a manner of providing the criminological literature, the sociological literature, with the language that they want, which is to describe, life that is violated, the half-life of incarcerated subjection, right? Without also deracializing, as Chavez says, or denying the Blackness, as Teagan just mentioned, the Blackness of social death, which has been transfigured in relation with the transfiguration of enslavement or racial slavery. And so it's a conceptual problem that we want to sort of sit with. And this is also complicated by both, like Mbembe and Patterson, for instance. They're both very critical of Black nihilist thought, particularly like Afro-pessimism, and which has done the most. The thinkers who are involved in the Afro-pessimist meta theory have done the most towards investigating and elaborating on this question of social death in spite of Patterson's critiques. So yeah, those are some of the things that we're thinking about.
No, yeah, I appreciate the summary. I think it's very fascinating, for one, of a debate, specifically speaking, of when with regards to social death. And it's one I go back and forth on, honestly, by week at this point, because on one hand, I agree with Cedric Robinson's, right, calling it that's nonsense, right? That quote of his, where I can't remember I can't quote it off the top of my head actually, but he has a quote where he critiques it almost explicitly. And then as one hand, I'm how else would you describe this condition? How else would you describe this, I'm saying, culture and political form ultimately? So, and so, yeah, I don't even know where I coherently stand on it. Because again, like I said, it kind of differs on a day by day, week by week basis. But I do appreciate the summary, and I do think there's a lot there that people can work with, and also debate amongst themselves. I do kind of tend to stray away from Patterson's work, for example, because of its transhistorical nature. Ultimately, so as someone who, I'm saying, calls myself a materialist, if anything. But yeah, again, I appreciate that. I appreciate both of you for breaking that down for us.
Yeah, I think it is. I think Patterson is and sort of leans into his controversial character.
Yeah, to say the least. To say the least, yeah.
Yeah. But I think him being a sociologist ought to be a manner of an introductory point for sociologists. But I think generally because of if sociologists talk about slavery writ large, they are inevitably going to confront the problem of racial slavery, of the transatlantic slave trade. And that's something that sociologists won't talk about. Mm-hmm. But I think too, going back to our paper, in our findings and in the writings that witnesses offer us, there is a split between Black and non-Black authors in how they imagine or confront the possibility of imagining freedom. And I think it makes this question of the racialized quality of social death and the conceptual value of living death in the death world especially problematic, because for instance, we'll have witnesses that white witnesses will write about what they'll do when they're free, released from incarceration, or one witness, for instance, wrote about how when they're especially down, emotionally down, they imagine themselves winning an Emmy Award or an Oscar. And then for many Black witnesses, there's this report of concern for life outside, right? Prison appears as I guess the non-event word is back again, but as an interlude to a degraded position.
Right.
Free also, right? Free, in air quotes. Yeah. And I think all of that is problematized by, I know people are very critical of the literature on Afro-pessimism, but I think for instance, Sarah Maria Sorrentino and Frank Wilderson have some discussion about what they call existence of reduced capacity. So there's this question of capacity, which is available to the human subject, but not to the Black, right? And so there's already some parallels visible between our reevaluation of living death and of social death, all of which, of course, is a bastardization of what Patterson and Mbembe would have wanted, probably. But yeah, I think it's still, we find it of importance.
Yeah. I'm glad you brought that up, because I was thinking about how kind of shaping our distinction between social death and living death through the essays of our witnesses is kind of just that we've seen that for a lot of, for some of our white witnesses, there's kind of this sense that if they were not incarcerated, they could find freedom in the outside world as it is. And so it is incarceration that keeps them not free, and they have the ability to imagine a sort of future and a freedom that doesn't radically change the world outside of the prison. Whereas we see it expressed with some of our Black witnesses that there is not freedom outside of the prison, that there is continual forms of being victimized and violated by the carceral state, but also just
Right.
anti-Blackness more broadly, that there is no freedom, even outside of prison, in the world as it is.
Absolutely. And I appreciate you bringing that up. I think that's a great point. And I also think it speaks to just like how limited much of our dominant understandings of these things, like this neat dichotomy between the inside and the outside, that we sometimes mobilize or whatnot, and not understanding. And that's why I think that some of the literature that talks about the prison as a function of domination, as a function of warfare in particular, is very interesting and intriguing to me, because I think it speaks more so that it speaks about like how it is an intensification of already existing social relations, right, as it currently exists in the specifically U.S. context. So yeah, I do appreciate both of you for specifying on that. But yeah, I'm going to let you go here in a second. One more question. We, like, along that same vein, I guess you discussed the psychological ailments, right, due to the increased isolation that led to thoughts of suicide and actual successful attempts, right? And those attempts and those thoughts being brought about as a means of escaping, what I'm saying, the degrading conditions of the carceral site, ultimately. So talk about that a bit, if you will.
Yeah, I think honestly what stands out most to me was an entry where someone wrote about how someone they knew committed suicide a few days before they were supposed to be released. And I feel like that specific example really speaks to kind of just the inner turmoil. And I don't know anything about like the identity of the person they're referring to, or like the background or the context to provide like more analysis. It makes me wonder if what if this person was in a position where they felt like they would not be free if they were released, or what if there was anything about release that they just didn't see as an option, or something that was worth waiting for. And I said, I'm lacking context as to why this happened, but I just know that it does speak to just the immense turmoil that this person and incarcerated people more broadly were feeling in just experiencing constant death and abuse on top of that during the COVID-19 pandemic.
Yeah, I think the writings from witnesses on their feelings of suicidality, and on the commonality or the commonness of suicides and death by suicide of the people around them were especially difficult to deal, to sit with, to navigate, and also were rather brutal reminder of the temporal distance between us and the witnesses that we read from. And what I mean by that is many of the folks who provided dates of authorship on their works were writing in the early months of 2020, and some, up until mid 2021. But still, this, person writes a letter about how they are feeling as though they have no escape, and they share it with the American Prison Writing Archives, which publishes it several months after that. And then we are confronted with their words several months after this, right? So then suddenly 3 years have passed, 4 now, since these words were written, and there's essentially no recourse. And I'm not sure if, having read written what we've written, that the recourse would be in the benefit of the witness, right? So if we were to reach out to a prison and say that we read that a person that's incarcerated there is feeling close to or thinking about suicide, the response would likely not be a benevolent one, right? It would just be more surveillance and more brutality. And I think that also gets at why we generally avoided any sort of policy implications note in the concluding section of our paper. There's, as fucked up as this is to say and to realize or grapple with there is essentially no political recourse, especially not from sociologists who, write endlessly into the void about what ought to be done to change or to better prisons, to, enact certain progressive policy, when I think there is a benefit, although a benefit isn't the right word, but a benefit to sitting with these people's writings, because otherwise they are sort of lost to the void. And so I think too that's another reason to emphasize that folks who are listening to this to check out the American Prison Writing Archives and read the words of incarcerated folks, not only for what is, at its base, or might be at its base, a selfish endeavor for social scientists like us, right, who make data of incarcerated people's words, but that, in order to breach that ever expanding distance between the prison and the public, which is an intention of the prison, you can find these words in the American Prison Writing Archives.
Absolutely. Well, thank you. This was great. I appreciate you both. You're both brilliant. And again, the article is awesome, and we'll try to link it in the show notes so people will have access to it if possible. But before I let you go, just want to give you both an opportunity to tell folks where they can find you, and then also maybe shout out any of the work that you're working on, and again, where folks can find and keep up with what you're doing.
Yeah, so I guess I'll start by saying that outside of this, I have also been recently working on, I'm a court watcher in Prince George's County. And so I sit in on bond hearings. That's something that I started doing as there's Court Watch PG is just a group of volunteers, basically a group of community members who sit in on bond hearings, which are actually audio live streamed online. So a lot of people are able to do it from home because courthouses are actually incredibly inaccessible, even though people are still expected to show up to them at specific dates and times during typical working hours, and regardless of whether or not they had transportation. And if they don't make it, then they get arrested. But yeah, so as volunteers, we are able to just kind of tune into these bond hearings, either online or in person, and we take notes on everything that happens, and with specific scrutiny for state actors and police. And so judges, prosecutors, police officers, people at the jail, and just the different actors that are involved in an arrest and subsequent bond hearing. And we use that information to write accountability letters. We've used that to inform a lawsuit against the county. And I have also been that's something that I just do as a member of my community on my own time, but that I would like to kind of turn into research, since I spend so much time taking extensive notes about, these bond hearings. And so that's something that's work that I do as well, that really anybody could do. There's Court Watch organizations popping up all over the country. And so if you look up Court Watch and then your city, or maybe the closest major city to you, then you might be able to find a Court Watch organization and get involved in it that way. But yeah, like I said, that's something that I do just on my own time, but is also shaping my research right now. And so, if anyone has any interest in that, or what we were talking about today, my email is just my name, T Murphy. It's my last name, actually. T Murphy. So TMurphyUMD.edu.
Yeah, and so my other work is tangentially related through my interests in social theory. And so right now I'm working on a couple of things, but primarily reconceptualization of radicalism, which I think I'm finding is, and by radicalism I mean radical social movements. And in the literature on social movements and sociology is particularly abysmal, reevaluating radicalism as what it ought to be, as an attack against radix, or the root of things, the world as a whole, rather than against its many minute, fundamental change in the minute or the immediate that so often is called radical, which doesn't say that it can't be, but that there is a distinction that's worth making. And along those lines, I'm hopefully planning on my dissertation will be a qualitative evaluation of revolutionary or radical folks, and particularly how they navigate the problem of meaning, which is also to say like the problem that radicals have when they try to articulate what they want from the world in a world that is, that they are against, right? So like it's like a linguistic problem, and I find that really fascinating. And actually, if you would call yourself a radical, and in the way that you're opposed to the whole state of things, you can feel free to email me and we can discuss a totally anonymous interview, and you can contribute your thoughts on the matter. And you can find me at DJ Lackey, Lackey, at umd.edu. So that's DJ Lackey at umd.edu. But thank you so much, Josh, for having us on. This has been really great. And, Millennials Are Killing Capitalism is such a powerful and informative resource. So we really appreciate it.
Yeah.
Bye.